Good morning, everyone. Jim Laird here from Largo, Florida. Dr. Stillman is actually here from the beginning. So,
hello, everyone. I'm not late today. Imagine that.
Did you get extra sleep last night or something? Or you had a neurofeedback?
I don't. And maybe that's it. Maybe we'll blame the neurofeedback or give it credit, whichever way you want to call it. Uh-oh, Jim's frozen.
We're frozen.
We were just complaining about how bad our internet here.
Yeah, I'm literally hardwired to the internet, and I've got on the little Wi-Fi thing, I've got one teeny little bar showing.
I know, man. It's stupid. But
so today we're going to talk about, we're going to do the best we can to battle through the internet. Blood pressure, HRV, blood pressure meds, and stress. And this comes from, I'm going to share my screen here. And I know people
we gotta plug the things we're up to, Jim. I'm going to start. I want to let everybody know that what Jim and I find super frustrating about having bad internet here in a very nice part of the United States is that we vacationed in Nicaragua as a business, trip. What was that? 5-6 months ago, 7-8 months ago now. And we had better internet in Nicaragua than we did here in Florida. And it's part of why people say to us, well, aren't you worried about moving to Nicaragua? I just put my deposit in on a house, for the record. I'm about to get the rest of the financing done probably this week. So I'm committed. I'm buying a property down there. Sweet. And if you don't know what we're talking about, go to my link tree. There's a link to the retreat that Jim and I are running at this community in Nicaragua, which we're Jim's building a beach, a gym on the beach there.
Yes.
He's not building a beach.
Not a beach on the gym.
For some reason, I always say he's building a beach on the gym, which makes no sense. So anyway, Nicaragua has better internet than some parts of the United States. So stop trashing on Nicaragua. It's a wonderful country. And we got a thyroid webinar coming up at the end of the month. People will love it. You will get a lot out of it. We're going to be spilling the beans on the things we discovered in, coaching 60 people through this course over 4 or 5 months, and what we found in their labs and what we found from talking to them. We had some rave reviews. I think that course, the enrollment's already open, isn't it, Jim?
It is. We opened it this week.
You want to tell people where to go so they can jump into the course? Because if you jump in now,
the link to buy the course will be in the description.
And the
you get a 10% discount if you buy it now.
Jim? Are we taking 30
we're taking 30 people. Okay. And you get a 10% discount if you sign up early.
That's right. Yeah. Great. So check that out and make sure you come to the webinar.
All those links will be in the description to the webinar and and to actually buy the course directly. It's a course with coaching anyways.
Yeah.
Right. So basically this is a lady that I've been working with for quite some time. People get sick of me hearing about how long it takes for people to break habits, change habits. And, this lady has a very large family, is also an engineer, very type A, has a huge farm, has lots going on. And when I first started asking her and talking to her, she's like, she literally was speaking like a machine gun. It was just like, blah, 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 blah. And I was like, how much, I think stress is a huge factor. He's like, I'm not stressed. So I made her get the Aura ring, and her respiratory rate was like 20. And I'm like, you may not feel like you're stressed, but and she's on blood pressure meds. She was on blood pressure meds, right? And so we worked on getting her diet was very imbalanced, very high fat. We worked on getting her more aware, but it took me several months for her to really buy in that stress was really the contributing factor to everything she had going on. And so she sent me a text. Sorry for the late night text. Wanted to let you know I've been working hard. I'm not overly working hard. Took my BP last night, past 3 morning, blood pressure had been 130, great. Just out of that hot tub, going to be doing some stretching, breathing off to bed. Okay. And that's really cool. But the big thing is we get into these other ones. We look at, this is interesting, my average heart rate variability since stopping my blood pressure meds. So she basically got her blood pressure down to a point where she felt comfortable coming off it. And her HRV, when we started, her HRV was 5. Her resting heart rate was like very high, 70, 80, and her respiratory rate was in the 20s. Okay, so now her respiratory rate's 11, 12, just with diligence and doing breathing drills consistently, and also with her deciding that she's not gonna get upset about stuff she really can't control, you know. Within 3 days of stopping her blood pressure meds, her HRV went from like down here to up over 70, and she was absolutely shocked by that.
That is a very profound difference.
Oh, it's huge. And then look at her resting heart rate down into 50, and she had brought it down, like it was up in the 70s when we started, and she had brought it down to there. That was before she, you know, stopped her blood meds. And once she stopped her blood meds, look at how far that came down. And then you know, so proud. This is such a crazy difference. And I was like, this is going to affect everything, hormone, digestion. Last night, I took my blood pressure before bed. It was 116/62. I've never had that low, just gotten out of the hot tub, you know, not getting out of the hot tub. It was just standalone without any hot tub or sauna.
Yeah.
I didn't think such a low dosage would affect so many things. I'm blown away. You know, little hinges swing big doors. There's my quote.
Yeah, and for the record, she was on a very common calcium channel blocker called amlodipine. I think it's called, the brand name is Norvasc. But we see people on medications all the time. They are not getting counseling on how to control the things they're being treated for with diet and lifestyle. We help them understand what a healthy diet, what a healthy lifestyle is. We help them dial things in. Then their vital signs, their blood pressure, their respiratory rate, their anxiety, all these things get better as a result of creating the healthy diet and lifestyle that they were missing in the first place. And all of a sudden, you know, and to be clear, when we're coaching somebody, we're not putting people or taking people off of medications, because you can't do that. You're supposed to talk to your doctor about that. But we find so many people whose doctors are just refilling the med and not having a conversation about how to improve their diet and their lifestyle. That with coaching, you know, they'll often go back to a doctor with a normal range, and then the medication can be stopped. So, you know, we just see this is why we have coaching programs. It's why we have group coaching programs, which you can learn more about in the description here. We found the same thing with thyroid. Many, many people in the thyroid program, they weren't getting enough protein. They weren't getting enough sunlight. They weren't getting enough sleep. They weren't getting enough rest. They didn't know how to relax. They were on medications that were ruining their thyroid function, that were being prescribed for other things that could be controlled with diet and lifestyle. And that's why the program was so successful, and people came out of it with absolutely rave reviews.
Well, and people don't think that they need, like, very rarely is somebody going to change a pattern they've been stuck in for years, decades, in 1 or 2 sessions.
Mm-hmm.
You know, this lady, I literally grabbed her and shook her several times a week. She would call me complaining, and I would say, are you doing this? Are you doing that? No, I haven't. And then finally, and you've seen this in the group coaching calls over and over again, where I've basically had to take, these are really smart people, these are really high achievers, and having to basically break them and say, look, this is the main issue you have. And until you put as much effort into your rest and relaxation as you do into driving yourself hard, you're going to be spinning your wheels.
Mm-hmm.
And finally, she got frustrated enough, and she bought into it. She started making the effort to set aside time every day to relax, to do the things I was telling her consistently. And then over time, she started like this. She's like, all of a sudden it clicks. It took me, when I was in a really bad place, when I got colitis, it took me almost a year to learn how to slow down and turn my hamster wheel off up there.
Mm-hmm.
And, you know, we have a person in town right now that we assessed, and I spent some time with them last night, and we just talked about, she has a lot of,
we had a patient fly to Florida
patient person. Yeah, we have a patient in town, and we talked for a good hour or two. We just were sitting out on they have a patio overlooking the beach, and they'd rent a place, and we just talked for an hour about how hard it is to actually slow down and not be worried and not be scattered. And for some people, it's just almost impossible for them to relax. And see, I had to work really hard at this. So I have a lot of empathy for people like this lady, because I've struggled with the same thing, and it takes time, and it takes a lot of work. And a lot of people just don't want to do the work. They'd rather just eat the potato chips or zone out and watch Netflix or,
Right.
you know, whatever it is, that whatever else they're doing is that they're medicating themselves with, right?
Well, I think it really takes a combination of, okay, here's where you are, here's where you're trying to go, here's what
Mhm.
it's going to take based on yours and my years and years of experience taking care of people, reading the literature, working with other experts, learning from all the gurus, influencers, all the, top people in the field who we've, respectively worked with and know. Here's how you're going to get there. Here's what it's going to take. Now we have to actually hold you accountable and not just tell you the strategy, but the tactics.
Mhm.
Little things like, for example, that hot tub, you know, uh,
Mhm.
hack is great. Like hot tubs can be therapeutic. They will drop your blood pressure. They should. If they
Right.
don't drop your blood pressure, something weird is going on. But
Sure.
there's a combination of other things you got to do in order to get that effect.
Right.
So we really have to spend time with people, and the accountability is huge because over and over again we see people, and Jim and I see ourselves doing this in this and other areas of our lives, where everyone, part of the human condition is what we call shiny object syndrome. Well, I could do all those things that Jim told me to do, but I could also buy this new blood pressure, supplement from Dr. So and so, which may be a great supplement. It may be perfect for you. It may work. But what we see is people, will find one or two or three little things, just like, they can't get out of bed and walk on their foot. So they buy a motorized scooter, or they buy a little, something that elevates their foot, and they have a little, they go on there. I don't know what you call those things. It's like a scooter for people who have had foot injuries. But
I
there's all
get
these
it.
different ways around the fact that your foot is not working. There's all these different ways around, oh, well, something I'm doing in my life is driving my blood pressure up. But that doesn't really address the root cause of the problem and lead to lasting, significant, durable improvements. And the other thing that we
Right.
see over and over again, and this is why we're so serious about this, is that fixing a number is not the same as creating optimal health, right? So we see over and over again people who've got great numbers sometimes, who are, because of their choices, headed for early death and disability, because even if the numbers don't reflect it, they're engaged in diet and lifestyle habits and choices that we know are associated with shorter life and premature disease. And then when we do see problematic numbers, any idiot can do things like throw vitamin D at people or hand you an iodine supplement. But there's a lot of examples in the literature where fixing a number isn't the same as providing or addressing the underlying issue or problem. A great example of this I covered yesterday in my Monday masterclass on how I use UVB light to heal in my practice. One of the things I mentioned in that video was that when you look at studies of vitamin D supplementation, they do have positive effects on your health, but they don't have a net effect on all-cause mortality. And some of that has to do with dosing, but a lot of it has to do with the fact that the sun, which is where people naturally get the majority of their vitamin D, almost no matter where they live, the sun is not just supplying you with vitamin D. It's providing you with red and infrared light. It's providing you with visible light. You're outside, you're kayaking, you're hiking, you're biking, think about all the things you do outside. By and large, they're healthier than the things you do inside. So the more outdoor people, as I covered yesterday, they have a healthier or a longer life expectancy by a matter of years. In fact, sun avoidance is a risk factor for death equivalent to smoking, which shocks a lot of people, but it's true. And so, again, this is an example of where people will think, oh, well, my vitamin D is low, so all I have to do is take a vitamin D supplement. No, that is not going to fix the problem of your indoor lifestyle and your lack of red, infrared light, visible light, et cetera, that is resulting from you living indoors.
The brain is undefeated. The brain literally controls everything, right? And there are factors such as nutrition and things like that. But a lot of people, if you are spun out in your head and you can't sit quietly and you can't sit calmly, you are in for a world of trouble. And that's where a lot of people in our modern world have gotten so caught up in this circular hamster wheel because of social media, because they're so busy. It's not like it was 50, 70 years ago where you did your chores and you came back and you basically sat on the porch and you played checkers and relaxed. Now it's like You know, you're looking at your phone all day. So we have to consciously make decisions to put ourselves in situations where we actually decompress and we're bored and we're relaxed. You have to do this in this modern world. You have to make conscious decisions to do that.
And this
And
is
the people,
increasingly why I
Mhm.
see both of us succeeding most with clients and patients by getting them to schedule these things,
Correct.
right? And this
Like
is one
well,
reason
tell them
why.
about the float tank, what you
Yeah,
discovered with the
I was
float
gonna talk
tank.
about that. Yeah. So for those of you who don't know, Jim and I will recommend the float tank to a lot of people. The float tank is a tank where you go and you float, and it's essentially a sensory deprivation experience, and it's profoundly impactful on people's health and their HRV in particular. And I did a couple floats earlier in the year, then I fell off the wagon, stopped doing them, and then I scheduled them. I scheduled them every single weekend, the last 2 weekends. I'm skipping one next weekend because I'm out of town, but I've got them scheduled, I think, through the like middle of the fall. And what you'll see and what I found is that I am not good at holding myself accountable for time spent relaxing. For the last, I don't know, 15 years of my life, I started studying Tai Chi when I was in high school. It's one of the most calming, meditative, relaxing practices there is. But I'm terrible at holding myself accountable and actually saying I'm going to spend 20 minutes outside doing Tai Chi, even though it's well within my grasp, right? But when you book something at a business that you're paying for, it has this psychological effect of getting you to do it, right? And it's funny because we see people, how many martial arts studios are probably within 20 or 30 or minutes or an hour of this house, right? But a lot of people don't have anyone. And increasingly with our virtual world, as well as traffic. I mean, traffic didn't used to be the problem that it is today, but how many of you live in places where the road system is essentially the same as when as 10 or 20 or 30 years ago, and there's 2, 3, 4 times as many people living in that area? This is part of what's driving people online and into the digital space, but that's why having digital coaching available is amazing, because we will get you to go out and do the things and schedule the things, and we'll talk to you about it, and you'll say, yes, I did it. And if you didn't do it, then you'll actually go out and do it the next time. So, we're our own worst clients in some respects, and that's part of why we're good at what we do. We understand what you're going through. We understand what you're struggling with. Back to the float tank. So my float tank, hour in the float tank on a Sunday leads to a 30 or 40 point increase in my HRV the following day. It's a huge difference. It goes from, 50s, 60s, maybe up to 90s or hundreds. And that's an incredible improvement. And that's part of why we're so serious about getting people to shut off and relax. And it's very hard for them to do that in their modern world, where there's so many ways for their attention to be captured, and for people to connect with them. It was
I
so
just
different a few generations ago.
I basically look at the float tank is getting 8 hours of sleep in 1 hour. That's
Mhm.
essentially, and with people that are really busy, you're taking them from one extreme to the opposite. So like type A people are the ones that fall into this the most, right?
Yeah.
And so you're taking someone to the complete opposite so they can live somewhere in the middle. And for people that don't have a lot of time, and here's the thing too, I've dealt with people that were like, I got in the float tank and I can't relax. I don't know how to relax. And I tell them you have to work at it. You have to get in there. You have to learn how to slow your breathing down. If you see a thought come into your head, you watch it. You don't engage in it. I've worked with people that are so wound up they couldn't sit in the float tank for 5 minutes. And that's where I was when I got myself in trouble back in 2008, 2009, somewhere in there. And it was really hard. I had to literally sit still. And I closed my eyes. I'm like, my goal is to sit still here quietly for a minute. And it was almost impossible for me to do. But over time, I learned how to do that. And if you are a hair on fire person and you actually learn how to calm down and relax, it'll be one of the most liberating feelings you've ever had. You'll be like, why have I been fighting this for so long? It's just crazy. Let's talk a little bit about the meds itself. What I think she was on a calcium channel blocker. Is that right?
Correct.
What action of the med basically would affect the nervous system like that to basically, and what do you is optimal pulse? I would say you're asking what is the best resting heart rate. That's going
Yeah.
to be
So
highly
yes, what do you think
individual.
an optimal pulse range is?
Well, that's going to be highly individual on the age of the person.
Sure.
And if what kind of athlete they are. But if your resting heart rate is like 70 plus, you definitely need to combine with a low HRV number. You definitely need, like, I'm 250 pounds. I'm almost 50. My resting heart rate is in the 50s, and overnight I go into the 40s. Okay.
Yeah.
So, and women generally tend to have a little bit higher resting heart rate than men do.
Mm.
But I'd say at least in the 60s. If it's higher, like if it's 65, 70, 80, you need to do more easy walking, easy cardio. You need to do some breathing drills to help you
Right.
relax.
Right. And we also have to look at chemical inputs. A lot of these people are relying on a lot of caffeine.
Sure.
They're getting a high intake of sodium and low intakes of potassium and magnesium.
Yeah.
They're very
All the
stimulated by their environment. They may have a lot of problems in their environment, EMF,
Right.
sound, noise pollution, psychosocial stress. So, yeah.
But I mean, the easiest way to basically lower your resting heart rate is to walk more. That's
Mhm.
the easiest way. Right.
Yeah.
And it's not walking like you're trying to race people. It's just like
Yeah,
chilling,
relaxing,
right.
meditative walking. Yeah. Very
Yeah.
powerful. Very
So
therapeutic.
what action causes the nervous system to be, because honestly, the nervous system in that case, honestly, is with that, with the HRV being lower and the resting heart rate being higher, the blood pressure meds are actually putting her in a state of being revved up, right?
Mm, arguably. I'd have to look into this and read some papers.
Mhm.
We might want to ask Mike Twyman. I wonder what he would say. That's our friend who's a cardiologist who's into a lot of the same stuff that we're
Yeah,
into.
I'll send him these pictures on Instagram and
Yeah.
ask if he'd like to come on here and talk about that.
Yeah, I'd
Um,
be really interested. I mean, the thing about medications in general is that you have to understand pharmacology and pharmaceutical drugs, for the most part, are based on the premise that the best treatment for a disease is to break the metabolic process that's driving it. So you have inflammation, you give an immunosuppressant that suppresses the inflammation. You have
right.
high blood pressure, you give a medication that prevents the blood vessels from clamping down or the heart from pumping to create that blood pressure. It's a little bit like saying, okay, the machine is not running well. We are going to throw a monkey wrench into the part that is not running properly. And this
Right.
is why, as you layer on medications and medications and medications, they all have side effects, right? And that's part of why, sometimes I don't even know what a medication is doing to someone in terms of its side effects, but we stop it because we can, it's safe, and the patient gets better. I mean, I can't tell you how many times in the hospital somebody would come in on 5, 10, 15, 20 more medications. They would be confused, they would be very sick, their blood pressure would be low or it would be high, and I would just stop medications, and that was all I did. I let the patient fast. I rehydrated them with pure, not pure water, but I mean water with saline or lactated ringers that doesn't have all of the, I mean, I hope it doesn't have all the garbage that we have in tap water, but it's better than what a lot of people are getting with soda, coffee, juice, tea, really things that have a lot of stuff in them. I'd rehydrate them, and after they detox from the meds, they would just come back to life, and they would say, "Oh, I feel so much better. Thank you,
Could the
Doctor
fluoride
Stone."
in the blood pressure meds have a contributing factor to that?
Fluoride's a big doping agent, maybe the wrong word, but I mean it's
Hmm.
used to precipitate a lot of medications. You'll see a lot of fluoride in asthma and allergy medications. You'll see a lot of fluoride in antibiotics, particularly the fluoroquinolones. Fluoride is a toxin. It's terrible for people. Adding it to the water supply has been one of the greatest mistakes in the history of public health, and I don't say that lightly. We get people off fluoridated medications, and they do so much better. It's sad that it's gone unappreciated by the medical community because they could be doing such better work, and their patients could be so much healthier if they understood how bad fluoride was.
You're such a right wing extremist, Leland.
Is that is being against fluoride now
Well,
part of?
if you exercise, you're a right wing extremist, and if
Yeah,
obviously you check all the boxes. So
yeah. Andrew has a great question. I'm on calcium channel blockers, but I believe that one of the root causes of my hypertension is potassium deficiency. I have low potassium in my HTMA, and potassium has a positive bearing On my blood pressure, would you recommend increasing potassium and dropping the calcium channel blocker? So number one, I cannot give you medical advice via the internet. That would be, I think, illegal and it's unsafe. When we see low potassiums on an HTMA, and I cover this more in my course with Clark, which you can get access to through the link tree as well. It's not actually about necessarily your intake of potassium. It's about how the handling of potassium is happening in the hair follicle in response to hormones. So somebody with a low hair potassium, if it's very low, like under 4 or 5 milligram percent, that person is what we call sympathetic dominant. And they're exactly a case like Jim has been talking about. They're on all the time. They're very revved up. They're very excited. They're very intense. They never relax. They never calm down. And that's part of why their potassium is low. You'll see that effect in people who are constantly overworking, overstressed, high intensity. So that's the number one thing, right? And that's, this fits the clinical picture Jim and I have been talking about for the last 25 minutes, right? So my approach with high blood pressure is a much longer spiel than we can give today. We could do that one day as a live, Jim. People would get a lot out of that.
Sure.
But yeah, I mean, we see the number one thing, and this is not even just the world according to Dr. Stillman. This is well published in the cardiovascular literature. The primary lesion that results in or accompanies high blood pressure is increasing intracellular sodium, decreasing intracellular potassium and magnesium. Across the board, when I see a hypertension case, I know there's almost always there's a relative lack of water in general. They're drinking coffee, soda, juice, tea, things that are often stimulating, which doesn't help. And they're not getting enough free water. They're often getting a lot of fluoride. And then on top of that, they're eating a low potassium, low magnesium diet, and they often don't even know it. There may be a hidden cause or contributor of sodium in the diet, which may or may not need to go down. I often don't reduce sodium loads in people who have high blood pressure because it often doesn't help them. And you gotta get some quantification here, Andrew, which is why I really, Jim and I talk about this all the time. We have courses that people buy, but we also prefer to coach people because it's where we see people getting the best results. It's very hard to create a course and have people execute on it 100%. They'll often make critical mistakes, which leaves them feeling like the course wasn't for them or it didn't work or it was a waste of money, when in fact there was just something missing that Jim and I can figure out sometimes in 5 or 10 minutes on a group coaching call in order to get people the results that they want. So
yeah, Andrew, if you're interested, you can join our Fundamentals of Wellness coaching program, which would just be perfect for you. You just go to stillmanwellness.com and you can put in the code Jim, all caps, you'll get 10% off and we can help you on there. But let me give you like a really quick, if it was me, what I would do. One, I would get outside in the sun more. Okay. Mm-hmm. That's going to help, basically, raise nitric oxide levels just from being in the sun. I'd focus on breathing through my nose as much as I could when I'm not talking. That's going to help your nitric oxide levels. I would get on the vertical diet by Stan Efferding, and then I would work in some sort of restorative yoga, meditation type practice, once a week or something along those lines where you're doing something to chill, Tai Chi, at least 1 hour a week of that, and then more walking outside, and I think you'll see a nice improvement. But I'd love to see you in the Fundamentals of Wellness. Glasgow, that's where my grandfather's from. So you just do the best you can, man. Luckily, you're adapted for that environment. Get out in the morning sun, get out and get as much as is possible. But that's where saunas come in, and we can talk more about that in the Fundamentals of Wellness.
Yeah, if you live in a cold, dark place, the sauna space is your best bet. I cannot recommend it enough. If you want to learn more about that, I got a great interview with Brian Richards on my YouTube channel.
Yeah, I'll actually put a link to the interview with Brian Richards just for you, Andrew, in the description, so you can watch all about saunas and all that good stuff. But, people in Northern hemispheres have been using saunas for centuries to overcome, living in a northern latitude. So,
Jim, I think that about wraps it up. Thanks everybody for tuning in. Remember, thyroid webinar, end of the month. We look forward to seeing you there. Thyroid course with coaching is open now. I encourage you to act and book your slot immediately because they are going to fill up. We've only got 30 spaces.
Yeah, only got 30 spaces, and we got a couple fairly decent podcasts coming up here, so that should fill up. And James, yes, thank you for congratulating me on finally getting 1,000 followers on my YouTube channel. Dr. Stillman has more than that, but I've been so inconsistent over the years on my YouTube. So now that I have some consistency, we got 1,000 subscribers. So
take care,
have
everyone.
yourself
Have
a great day.
Get outside.
Make sure you get outside. Take care.